sabotage tactic, or at least scare tactic. All the medical providers, grab some syringes with needles on the end. Have them full of saline or succinylcholine, you know, whatever. That will probably be a deterrent.
Whoa, we showed you this last night. Truly incredible and disturbing video. None of this is normal. It's actually the opposite. It's scary. Imagine going to the hospital for some kind of procedure only to have your nurse or doctor sabotage your care and your health, all because of who you might have voted for. That nurse, thankfully, has been fired for telling people how to hurt ICE agents, how to hurt people, which is insane. It is certifiable. Dr. Drew Pinsky is the chief patient officer at the wellness company and host of the popular live streaming show Ask Dr. Drew. And we've talked about this. It's only getting worse. Here she is again. Take a look.
Anybody got any poison ivy, poison oak in their yard? Get some of that up with gloves, obviously. Get it in some water. I'm going to put it into a water gun. Aim for faces. Get on Tinder, get on Hinge, find these guys. If they're an ICE agent, bring some X-Lax and put it in their drinks. Get them sick.
Dr. Drew, it borders on criminal. What do you make of that as a physician?
Oh my God, it's unthinkable. The fact that our bioethical standards have eroded to the point where somebody thinks this is kind of humorous or a good idea to broadcast this on social media, it's beyond reproach. It's so difficult for me to get my head around, coming from an era where the professionalism of the nursing and medical physician profession was at the highest standards. We have completely eroded the professionalism. I mean, look, we shouldn't be so surprised. Medicine has been under attack for 30 years. Congratulations, everyone. You've done it. You've turned medicine into just a 9-to-5 job. You've eroded the professionalism. And it was all set up. Let's remember, during COVID, when same physicians and nurses were saying, I'm not going to treat people who are unvaxxed, or they shouldn't be allowed to be admitted to the hospital. I mean, think about this. Thank God the hospital sees the liability, not because they're so morally just, because they see the liability, they're essentially obliged to fire this person.
Let's do that. Let's go back to COVID 6 years ago. Here's Jimmy Kimmel. Take a look.
Yeah. Vaccinated person having a heart attack? Yes, come right on in. We'll take care of you. Unvaccinated guy who gobbled horse goo? Rest in peace, Wheezy.
Okay, so in Florida, Dr. Drew, no, I want to hear, but in Florida, this anesthesiologist just lost his license for refusing to provide care to Trump supporters. Florida, by the way, pretty red state. Your reaction just to where this is going and what we came from with COVID.
Yeah, I mean, look, Jimmy's a comedian, a talk show host. If he wants to say these things, that's one thing. But the fact that it eroded.
Not a funny comedian, though. I know you live out there, but that's not. There's nothing funny about that brainwashing.
No, there's nothing funny about it. You're absolutely correct. That whole episode should have been a massive wake-up call, literally for everyone. Unfortunately, some people are still hypnotized, and some people are still eroding their moral compass with all this. Look, our job as physicians and nurses is to serve the patient in front of us. I have had to take care of disgusting murderers before. It was hard. I had a moral discomfort in my body taking care of this individual. And I wanted not to. I wanted to spit on him. I did my damn job. That's the way it goes. And look, you can have all the feelings you want. Do the damn job and do it well. If you feel you can't do it well, you're impaired by these feelings, you can quietly step aside and put somebody in your stead. But you cannot abandon the patient, and you cannot refuse the patient care.
No matter what. If the roles were reversed, do you think the situation is different?
What do you mean?
Let's say it was a conservative physician and a liberal patient that didn't get the care that they required. Do you think this might be a bigger story?
It would be a bigger story, and that individual would be hunted down and appropriately taken to justice in some fashion. But yes, you're absolutely correct. The fact that to me, the thing, it's not just the erosion of the professionalism and the bioethical standards. I've seen it on full display. Look, it started, what really got me was back when Aaron Cariotti, the head of the bioethics department at UC Irvine, was fired for taking a bioethical stand, saying, I don't think you have the criteria for a mandate for this yet unstudied vaccine. That was where we started this slide, in my opinion, at least when I became aware of it. But the fact that we do this and people are at the point where they think it's funny or casual or something that's okay to be broadcast on media. It's one thing if they were sort of in their quiet moments or admitting it to friends or something. Guess what? People would pull them aside and yank them into appropriate behavior. But going out on TikTok, going out on social media and thinking it's funny or it's going to be reinforced or applauded, that is a sign of not just the moral deterioration, but the brainwashing that's been going on. People need to wake up from how brainwashed they become.
Such a good point. And look, we forget because it was 80 years ago. When Hitler's bunker was raided in 1945, there were physicians present just in case Hitler was still alive. He would be there to stand trial, and those doctors would have to treat one of the worst human beings in human history. That's the role of a doctor, and nobody knows that better than you. Dr. Drew, we appreciate you being here tonight. Good to see you.
Information. Truth is freedom. Is Newsmax. It's real news for real people.